What if you went to the doctor but felt worse when you left? Most of us don't think twice about going to the doctor's office. We go in, get our treatment, and leave. But for members of the LGBTQ plus community, this same experience is highly unlikely. Guadalupe Benitez from California was denied infertility treatment in 2001 because she's a lesbian. Tony Ferrioli had to go to multiple places just to get seen, and then he was denied a hysterectomy due to transphobia from his doctor. Jerry Ann was severely beaten a few years ago and went to the hospital to get treatment for her injuries, but the doctor wouldn't even examine her or answer questions because Jerry Ann is transgender. Because of that incident, she has to travel over an hour just to receive medical care without discrimination. Alexa tried to get a consultation about breast augmentation to confirm her identity, but they told her they didn't take transgender patients. Unfortunately, these are all common stories among members of the community regarding healthcare. My name is Myra Mead. I'm a junior at ETSU. As a healthcare worker and a future doctor, I've seen discrimination towards members of the LGBTQ plus community, and because of my women's studies minor, I've seen the impact it can have on them. Discrimination against members of the LGBTQ plus community in healthcare is detrimental and unethical. It's detrimental and unethical because it impacts their health and overall well-being. Before we get started, I'd like to talk about the frequency of this discrimination. Over 50% of members of the LGBTQ plus community have experienced some form of discrimination from healthcare staff, according to Lambda Legal in 2010. Lambda Legal also reported that of that percentage, gender nonconforming and transgender people face discrimination 2 to 3 times more frequently than other members of the LGBTQ plus community. In addition, 8% of all members of the LGBTQ community have been refused care based on their actual or perceived sexual orientation, and 20% of transgender people have been refused care because of their actual or perceived gender identity, according to Lambda Legal in 2010. So, as you can see, this type of discrimination is a significant issue and needs to be addressed. Now that we know the frequency of the discrimination, I'd like to talk about how it's detrimental to their health. Discrimination discourages members of the LGBTQ plus community from seeking medical attention. According to Misra and Rooney with the Center for American Progress in January 2018, 8% of members of the LGBTQ plus community said they avoided medical care because of discrimination from the medical staff. A local example of this is Clara, who lives in Knoxville and has a transgender son who hasn't been to the dentist in years due to fear of discrimination. A common example of an effect that avoidance due to discrimination causes is the purchase of non-prescription hormones online. According to an interview with Dr. Strumsa conducted by NBC News in November 2020, 1 in 10 transgender people are obtaining their hormones this way. This is very dangerous since it's not monitored by a medical professional. According to Dan Avery with NBC News in 2020, estrogen therapy is linked to blood clots in the heart and lungs, which can increase someone's risk of a stroke or breast cancer, while testosterone can cause the blood to thicken, leading to heart attacks and or strokes. In the same article, in an interview with NBC News, Cecilia Gentili stated that, "Every time I go to someone who's not my doctor, I get misgendered. I get uncomfortable questions, so if I'm not dying, I'm not going to the doctor." This, unfortunately, is a shared mindset among members of the LGBTQ plus community. There's also a lot of misinformation. For example, many lesbian women are told they don't need pap smears to test for HPV, but according to Ryan Thorson with Human Rights Watch in 2018, lesbians have higher rates of cervical and breast cancer due to the lower screening rates. Lesbians are 25% less likely to get a pap smear than heterosexual women, according to Casey Halter with Cancer Health in 2019. The solution to discrimination towards members of the LGBTQ plus community lies in the training of medical staff. According to Rachel Cohen with NPR in January 2019, on average, medical students only get 5 hours of training specifically for members of the LGBTQ plus community. If all medical staff members were retrained to be more inclusive and aware, then the health outcomes of members of the community would be far better. In conclusion, we've discussed how discrimination among members of the LGBTQ plus community is detrimental and unethical because it impacts their health and overall well-being. To address this issue, medical staff needs more training specifically for members of the LGBTQ plus community. As famously stated by Laverne Cox, if someone needs to express their gender in a way that is different, that is okay and they should not be denied health care. Thank you and have a great day.